Now that you have filled out all of the relevant questionnaires, you may be wondering, what actually happens during an ADHD assessment at Harley Street Mental Health? You can log into your video call by clicking the Start Video Consultation link in your booking confirmation email and allowing permission to your microphone and webcam. You will then join the video call where your assessment will take place. If you have opted to visit us at 10 Harley Street, simply sign in at reception, then your friendly psychiatrist will meet you in the waiting area. Regardless of whether you choose to see us in person or virtually from the comfort of your own home, you can be assured of a thorough assessment in line with NICE guidance with an expert clinician. During the assessment, the doctor will explore 5 main areas with you. These are childhood symptoms, adult symptoms, impact of symptoms, consideration of alternative explanations, and consideration of collateral information. Let's explore this further. As ADHD is a neurodevelopmental disorder that begins in childhood, it means that in order to be diagnosed with ADHD, there must be evidence of symptoms that have been present from a young age. During the assessment, the doctor will review information provided by yourself, others, as well as asking you about your own recollection on how difficulties with focus, concentration, hyperactivity, and impulsivity may have impacted your childhood. In some instances, individuals may have developed masking techniques during their childhood or relied on a naturally high IQ, so if this is the case, please do not worry and be open with your clinician about this. The doctors will talk to you about your current challenges, such as difficulties with focus, organization, impulsivity, and emotional regulation. They'll ask how these symptoms present in your life currently, asking open questions to give you the opportunity to explain in depth from your point of view. The doctors can use the questionnaires you filled in earlier as a reference point to expand and clarify different symptoms and experiences. The doctors will explore with you the impact that your symptoms are having on your day-to-day life, whether it be in education, in the workplace, in your home life, in your free time and hobbies, in your social life, or even in your self-esteem and how you view yourself. As part of the assessment process, we will need to consider the question, is there a better explanation for your symptoms and experiences? Broadly speaking, this section will be divided into 2. On one hand, the doctors will want to know about your physical health background, exploring common conditions that can cause ADHD-like symptoms. These will be conditions such as long-term illnesses, anemias, thyroid dysfunction, post-viral fatigue syndrome, and nutritional deficiencies such as B12, folate, and iron. On the other hand, the doctor will also want to know about your mental health background. Our expert doctors are well aware that at least 80% of individuals that suffer with ADHD also suffer with other conditions such as anxiety and depression. What they will want to determine is what offers the best explanation for your difficulties with inattention, hyperactivity, and impulsivity. The doctors will explore difficult topics such as anxiety, depression and low mood, trauma history, personality disorders, and other neurodevelopmental conditions. We appreciate that these topics can be difficult to talk about, which is why at Harley Street Mental Health we ensure that our doctors are friendly by nature, down to earth, and genuinely want the best outcomes for their patients. The doctors will want to explore with you any information from other sources such as colleagues, family member, or close friends who may have observed your symptoms over time. This is known as collateral information and will be the information that informants filled in as part of the questionnaires relating to your childhood and adult life. You are also welcome to submit any other information you may feel you want the doctor to see, such as school reports or work reports. Throughout the consultation, there will also be an opportunity to discuss your experiences at school, at work, with recreational substances, with the criminal justice system, and anything else you may feel is relevant. Towards the end of your consultation, the doctor will let you know whether or not you have met the diagnostic criteria for ADHD. If you have, they will agree a treatment plan with you. If you have not met the diagnostic criteria, the doctor will explain their thought processes and what they think may be going on. In some instances, Your result may be inconclusive, in which case we may recommend further testing outside of the assessment, such as a QB test. Either way, we will be here to support you through your ADHD journey. Please watch our next video to find out more about the different treatment options with Harley Street Mental Health and what to expect after an assessment.